Member for Peace River North.
Thank you, Honourable Speaker. The lack of a back-to-school plan by the Premier has meant a scary return to the classroom for students, staff and teachers. The number of cases in our schools are on the rise. We've seen the Education Minister already have to backtrack on notifications and masks. And British Columbia, sadly, is behind when it comes to using rapid tests for school exposures. Mr. Speaker, Ontario, Quebec, Nova Scotia have all announced rapid testing plans. But here in BC, parents are faced with long lines, delays, and panic when it comes to getting their kids tested. Even the Premier's former senior advisor, Myra Orrick, agrees, and she says, and I quote, "It took 2.5 hours to get my kids tested for COVID-19 this morning at BC's Children's Hospital. Given the lack of protection for kids, the least the province can do is to increase testing accessibility. More sites and more staff are seriously needed," end quote. And I can attest the wait is longer in some rural areas. We know that this government is sitting on hundreds of thousands, if not millions, of rapid tests that have come from the federal government. We've seen the continued stubbornness, resistance by this government to use rapid tests. So will the Premier protect school-aged children and use rapid tests in schools today?
Minister of Health.
Thank you, and thank you to the member for his question. I know he's expressing concern of many people in this community. In September, the gold standard test, the PCR test, there were more PCR tests in September than at any other time in the pandemic. Indeed, 4 times as many in the Northern Health Authority, as I've discussed with the minister, than had taken place during the height of the 3rd wave of COVID-19. We are increasing PCR testing. Never more than in the month of September have rapid tests been used more in BC. The technology as well is improving. The capacity to have at-home tests is improving, and those things will be explored by the people who are directing our testing policy, the people who are qualified to do it, the people who have been leading it from the beginning, our leaders at the BC CDC and the Provincial Health Office. And our government will continue to support them as they make every effort to ensure that children, adults, everybody are protected as much as absolutely possible from COVID-19.